The nature of type 1 diabetes makes the potential of fasting a bit more challenging. The fact that I need insulin several times a day means ideally I should be eating frequently and having enough calories as well. Fasting specifically in northern hemispheres such as Canada would entail long fasting hours. So already the risk of fasting for a person with type 1 diabetes is a bit higher than other people with diabetes who do not take that amount of insulin or do not have type 1 diabetes. So we need to bear that in mind and have a chat with your experts, the healthcare professionals, doctors, nurses, and dietitians to find your level of risk. The level of risk is not just dependent on the fact that you have type 1 or on intensive insulin, multiple insulin injection. It also takes into account many of the other important points. How frequent do you get hypoglycemia, low blood glucose level? How severe are they? Do you feel them or not? How good is your blood sugar levels in general? And whether you have any other complications of diabetes or other medical conditions that can make fasting a bit more difficult. Did you have any recent acute complications related to diabetes, or there is other medical conditions that will make fasting a bit more difficult? So the recommendations do not say it's not possible, but certainly it says it could be more challenging. So number one is please have a chat with your experts in the field about diabetes and Ramadan, because it will be very important to have that level of discussion to know if it's safe for you to fast or not. If you decided to fast, then it would be really important to go through a number of steps. Number one, it's very important to try as much as possible before Ramadan to get your blood glucose level as good as possible. That would help. If you have hypoglycemia, if you do not feel the hypos when the blood glucose goes low, if you get a very frequent hypos several times a week, then certainly you are at a very high risk, and the advice is you probably should not fast to protect your health. Now, if you decided to fast, then the insulin doses need to be adjusted. There's no better person to do that adjustment for you than your own doctor. In general terms, we advise that the insulin doses that you normally take during the fasting hours need to be reduced. The level of reduction would depend on your own personal circumstances. So that's not something possible to just advise every single person about it in such a video. But in broad terms, the insulin doses during the fasting hours need to be reduced. To be safe, you would need to check your blood glucose level 3 to 4 or 5 times a day, specifically during the fasting hours. The most vulnerable time is during the late hours of the fasting, the last 4 to 5 hours after fasting. But also, of course, we all know that sometimes our food in Ramadan is a bit too rich with sugary food, with sugary drinks and fatty food. So perhaps also you need to definitely keep an eye on the blood glucose levels in the evening as well as after the early morning meal to ensure that the sugar levels are not too high or not too low. If you see a low blood glucose level, you must stop the fast immediately, absolutely immediately, even if there is 1 hour left before it is time to break your fast. Equally, if your blood sugar levels are shooting high, you need to check your ketones and consider stopping the fast. Several considerations for other aspects as well of what I eat, what I drink. I need to replenish my fluids during the eating hours and avoid excessive salty food and excessive caffeine. We do not advocate that Ramadan would be a month that we do nothing and be lazy, but certainly moderate to high exercise need to be ideally done during the eating hours and not during the fasting hours. So overall, for a person with type 1 diabetes, it could be a bit more challenging compared to a person taking tablets or with different health conditions. You do not have to push yourself to fast against medical advice or against your safety. There is always other things you can do to compensate for the passion for Ramadan. This is certainly for the healthcare benefit of the person with diabetes, as well as the religious recommendations. The first step is have a discussion with your doctor or your nurse or your dietitian about the risk level that you have in case you fast. We know that sometimes Ramadan fasting could be associated for some people with low blood glucose levels or with high blood glucose levels, or with a bit of dehydration for those who are exposed to excessive physical activity and maybe working in hot weather. So have a discussion with your doctor about whether it's safe for you to fast or not. The second issue is to get ready for this. Ramadan journey is not an easy one, so obviously the glucose levels and the sugar levels need to be at its best. For safety in Ramadan, I need to be committed to check my blood glucose levels as frequent as possible, specifically during the hours before the end of the fast, kind of from afternoon until sunset. This is the time where the person could be most exposed to low blood glucose levels. But don't forget to check at other times of the day, specifically as well after eating, because we all know Ramadan is a month of celebrations and many, unfortunately, overindulge a bit. So checking on my blood glucose levels would also be very good. Of course, my medication could be modified in type or in dose, and certainly in typing, in the timing. That would be also important to have that type of discussion with my doctor. Now, with Ramadan coming, we all sometimes find our physical activity slightly different. If you're a person who loves to exercise, and if your level of exercise is moderate to high, perhaps the timing of the exercise could be later in the day rather than during the fasting hours. But light to moderate exercise is not a problem at all. Finally, the choice of food and drinks. These are very important to avoid the excessive quantity and frequency of food that is very rich in sugar and in fats. And talking about food as well, do not forget to have the suhoor meal, the early morning meal, because if you have diabetes and you're on insulin or on other drugs that are called sulfonylurea, these drugs stimulate insulin secretion. So if you do not eat for not just for the fasting hours, but as well during the suhoor, then your risk of having a low blood glucose level would be a bit higher. So for a safe Ramadan fasting, you need a good discussion with a healthcare professional that understands Ramadan. Listen to them, take the risk assessment seriously. The guidelines that are available are very robust, and they are also including the opinion of the religious authorities in many countries. If you're safe to fast, then make sure to understand the timing and the doses and the type of medication that you will be having. Some medication might need to be reduced, some might need to be modified. Checking the blood glucose level on a frequent basis, specifically during the afternoon and the early evening before sunset, for the detection and the prevention of low blood glucose levels, but certainly also checking during the eating hours for high blood glucose levels that potentially can happen. Drink plenty during the non-fasting hours, avoid excessive salty and excessive coffee, and please make sure to have suhoor. Lastly, take stock of what happened during this Ramadan and make sure if you have any hypos or excessively high blood sugar level to break your fast and to replace or recompensate for these days in the future. There is nothing to worry about and to make you push yourself against your health. You're meant to look after your health during the month of Ramadan and beyond.
If you are deemed at high risk for developing complications because of fasting, it is recommended that you don't fast because of the complication that you can have because of your health condition. It is recommended that you see the diabetes care team 1 to 3 months before the start of Ramadan and let them know that you are intending to fast, and ask them, what are those complications that you can have, and how to recognize those complications, and how to prevent them, as well as how to manage them. It is very important that you have an open discussion with your diabetes care team in terms of how to manage high blood sugars during fasting, as the team knows you the best and can give you an individualized advice. But I will review the general recommendations in terms of managing the high blood sugars. So if your blood sugar is more than 16.6 millimole per liter, and you're having the symptoms of high blood sugars such as frequent urination, increased thirst, hunger, blurred vision, nausea, vomiting, abdominal pain, your breath smells fruity, or you're having difficulty breathing, it is very important that you break the fast and hydrate yourself. And if you live with type 1 diabetes, or you're taking certain medications which can put you at risk to produce blood ketones, it is recommended that you check the blood ketone level. And if your blood ketone level is more than 0.6 millimole per liter, it is recommended that you break the fast and hydrate yourself, as well as take the supplemental dose of the rapid acting insulin. If you don't know what is diabetes ketoacidosis is, or the blood ketones are, please reach out to your diabetes education team so that they can educate you on diabetes ketoacidosis prevention, recognition, and management. Hypoglycemia means low blood sugar level of less than 4 millimole per liter, or you're having symptoms of low blood sugar such as shakiness, lightheadedness, being confused, feeling really, really hungry, sweatiness, headache, or feeling weak. Please check your blood glucose. And if your blood glucose is less than 4, it is recommended that you open your fast and treat that low blood sugar with the fast acting sugar. So the fast acting sugar can be 3 teaspoons of sugar in water, 1 tablespoon of honey, or 3/4 of a cup of a juice. And after having the fast acting sugar, please wait for 15 minutes and retest your blood glucose. And if your blood glucose is still less than 4, please repeat the fast acting sugar treatment. And once your blood sugar is above 4, it is recommended that you have a balanced snack which contains carbohydrate source and a protein source, so that your blood sugar doesn't go down again. So example of a balanced snack can be a slice of toast with peanut butter, or it can be a fruit with the nuts. So have that so that your blood sugar doesn't go down again. And if you are having a pattern of low blood sugars, please speak with your diabetes specialist, diabetes educator as well, so that they can help you find out why those lows are happening, and can rectify the cause so that you don't have those lows again and again.
Well, the passion for fasting Ramadan certainly could be a motivation for all of us who have diabetes to try to improve our blood glucose control and our health in general with getting and adopting better habits, better eating habits, better drinking habits, and certainly better physical activity. Sustaining the good levels of frequent checks of the blood glucose levels certainly would help. During Ramadan, there is a passion to do all this, to fast, and that certainly would benefit the person with diabetes in the future Ramadans as well as in the future months. One last point, perhaps your experience during Ramadan was not as easy as you thought. And that could be also a very important point for future years. Taking stock of what happened and what were the challenges would certainly help you and your healthcare professionals in the decision for future Ramadans. Have a discussion with your doctors and the nurses and the dietitians and record all the challenges that you could have faced so that we can see whether they could be overcome in the future or not. I hope you enjoy a very safe Ramadan.